instead of having to see 100 patients in a month and having, I forgot what you told me the average was, acceptance rate, having an average of 20 or 30% acceptance. What
Mhm.
about slowing down for 50 patients and getting your acceptance up to 50%?
This is Growth in Dentistry, a dental intelligence podcast, where we ask the question, what does growth in dentistry mean to you? I'm Steve Jensen, a dated dental nerd and your host. Welcome everyone to the Dental Intelligence podcast, Growth in Dentistry. I am super excited about our guest today. Now, before I jump in, some classic things to knock off the list. First of all, thank you to Dental Intelligence for sponsoring this podcast week after week to get this great content out there to the industry. For those who are new listeners, Dental Intel always offers a $50 gift card if you'll go check out and see what they're doing. A lot of people don't know that they moved into engagement and insurance. There's a lot of sweet stuff that's coming out. So if you haven't checked them out in a while, they'll get $50 for just going and checking them out. The link will be in the show notes. The second thing, I always like to give thanks to the marketing department before we get to the end of this for producing this week after week. They do awesome work. And then lastly, I always like to thank our guests for joining. And this week we have Dr. Ben Turnwald. Now, I'll tell you a little bit about him before I let him tell about himself. This is a deep dive episode as well. So we haven't done one of these in about a month and a half. Well, we've done some replays. So I'm excited to bring back a doctor so you guys can learn from your peers. Hear what are they doing to be successful. So Dr. Turnwald went to University of Detroit Mercy for dental school, has been in the practice he's in now for 14 years. He's owned it for about 10, and it hasn't been sunshine and rainbows the whole time. Even he mentioned to me when he first got started, he didn't even have an office manager. So he was wearing all of the hats. And part of that has made it so that his hands and mind have been in the whole improvement of this business. And when I went and was trying to find, hey, who are some guests we could have on? Dr. Turnwald's practice is in the top 10% of performers across the industry in nearly every metric that Dental Intel performs. So I'm super excited to pick his brain on how do they keep patients in the practice? Like their retention is wicked high. How are they getting case acceptance at such a high clip? They're like way into the top performers in that space. And I even like dug into some very like specific ones. Like I was interested to see like, okay, are they good at getting bigger cases done? And sure enough, even when we jumped into the bigger cases, they were good at getting patients to say yes, which I'm just so excited to have you join Dr. Turnwald. So thank you for joining the podcast today. Let's go ahead and start. Will you tell us a little bit about yourself, more about the practice? Why did you get into dentistry? And give us some background.
Yeah, sure. First of all, thanks for
Oh,
having
hey,
me.
one thing too. Let me mention this. That he just let me know. So Dr. Turnwald actually is starting to doing some consulting. So I don't want to forget this right out of the gates. You're going to hear some things from him where you're like, hey, this guy, I wish I could engage with him more. And he's offering that now. So as you listen to him, please don't hesitate. At the end, we'll give his contact info. It will also be in the show notes. So if you want to shoot him an email while you're listening, so you don't forget, please reach out to Dr. Turnwald. He'll be a great resource for you if you're looking to scale your business and do some of the things that he's done. So sorry to interrupt you. Want to make sure I got that plug right at the beginning, so folks know that they can engage with you. You're open to helping some people out. So
Yeah, I definitely like sharing my knowledge and sharing my experience so that we all don't have to go through all of this alone. And to kind of piggyback off of that, I've been very, very fortunate to have some really great mentors that have helped me throughout the years. And one of the things that probably the two most influential ones told me was that once I got to a point where I was no longer, they called me the new guy, it was then my turn to give back. And so the philosophy is sort of to leave the next generation of dentists one or two steps ahead of where you were when you were at that experience level. And so that's what I'm now excited to do for people with my coaching program. But a little bit of background on me. You already mentioned I've been in practice about 15 years. And when I first joined my practice in 2010, there was no website. We had paper charts. There was no office manager. And so the practice has definitely evolved since then. Now we're considered a high-tech practice. We are paperless. We do intraoral scanning. We do now have an office manager. We have a very robust website that I'm super proud of. And I feel like yeah, it wasn't all sunshine and rainbows, but I did learn a lot by wearing all those hats. I did the marketing, I did the HR, I was the office manager. And so I think that has not only made me a really good a business owner, but also a better leader, because now I can, when I'm coaching the front office team, they can't tell me like, well, you don't have to do this job or you've never done this job before. Actually, I have. And I know what the struggles are when a new patient calls and you're trying to convert them, that type of thing. So yeah, I was an associate in my practice, became a partner, and then bought my senior partner out several years ago, and the practice has continued to grow since then. And yeah, it's been some ups and downs, but very, very fun. And currently, I'm what I consider an executive dentist.
I was going to ask that. If you're doing some like consulting, I would assume that your like clinical days have lessened and you got some associates that are working more.
Yeah, like most of us in dentistry, we've got those type A personalities and we always want to get the A plus. And so I was trying to grow my practice at a very high level, offer a really great experience, maintain a fee-for-service practice, lead a really great team, but also do some really complex dentistry comprehensively. And I found that I was at a certain point burning the candle at both ends, and I wanted to be excellent at both. And so a couple years ago, I made the decision that it was time to maybe choose one or the other to focus more heavily on. And my business brain won that discussion. And so I've sort of phased myself out of clinical dentistry. I'll see a few patients here or there, but I've been able to hire some really, really stellar associates that have picked up the reins and really done a great job in taking care of my patients.
Yeah, I love that. So you're in an interesting place, then a place where you can teach, a place where you can share. So let's start about like patient retention. Let's talk about that one first. So I'm going to share some stats actually, just so that people have some context, or if you like are using Dental Intel and you want to log in and be like, yeah, where do I sit on this one? So if you look at pre-appointment percentage, so that's like our best metric to understand, are we going to keep our patients? Or are we not going to keep our patients? The average practice in the US has 49% of their patients pre-appointed. Okay, so like half of them are scheduled to get lost unless we go do a bunch of recare phone calls, which we do, of course. Now, you are at 70% of your patients are reappointed across the whole practice, and even higher in hygiene. And I think that probably speaks a lot to your relationship with them and maybe some systems. So like what I'm believing here, when I see pre-appointment high, I believe that the patients genuinely like the business. So can you talk to like, why do you think your pre-appointment percentage is high? Tell us about the way you treat patients, your methodology, and then maybe some of the systems you use to help make sure that patients are excited about coming back.
Yeah, I mean, it's really all of the above. I've always considered my practice to be a relationship-based practice. And so, I mean, even simple things like when someone walks in the door, like greeting them by name. I mean, is my front office person going to remember? She's got an amazing memory. She probably remembers most of them, but is she going to remember 100% of the people, and especially like a new patient? No. But if we know there's a new patient coming at 1 and you recognized everybody else that's walked in the door, we can probably assume that that's Sally, the new patient. The other thing that we do is we take pictures of all the patients. So we're lucky enough to be able to see people starting to walk up our stairs before they enter our glass front door. And so you can quickly go through the schedule and match the picture with the face. So small things like that, I think, make a big difference to people. And I grew up in a really small town in Michigan, and I would go to the post office, I would go to the hardware store, and someone might not know my first name, but they knew I was a Turnwald boy. Like, yeah, I really liked that growing up, people knowing who you were. And so I've tried to bring that into my practice as well, even though I'm not in a small town, because you really do have a community of patients. So I think small things like, being greeted by name when someone comes in, appointing enough time, whether it's for a new patient experience, a hygiene appointment, a restorative appointment, to just chat with the person and talk to them as a human. Particularly with the hygiene patients, they might only come in every 6 months, but we have a lot of patients that go down to Florida for the winter. Like, how was your trip down to Florida? How was that vacation you were telling us about? How's the new puppy? I think that people really value that. But when you're all business and it's like, the butt's in the seat and the chair's already going back before they can even say like, I'm doing okay. I think that really makes a difference. So I definitely think the experience, I've just put a ton of thought and intentionality into really giving our patients an ultimate experience, spending quality time with them. And I think a lot of that goes into also then having a really friendly team of superstars who will, chat with the patients and anticipate their needs, see what they can do to give them a good experience. I think that makes a huge difference as well. And then of course we have systems in place. So, at the end of every visit, let's talk about why it's important for you to come back in 6 months and not say, let's get you scheduled for your next cleaning, or do you want to schedule? Like, those are all phrases that are really easy to say no to. So one of the things we've actually done really simply is we don't call it a cleaning. We call it a clinical cleaning, because
interesting swap.
Yeah, so people can brush their teeth at home and clean their mouth. What we're trying to do is make this sound more clinical. We have a whole industry of very highly trained and highly skilled hygienists that are doing a clinical procedure on somebody. And so we've experimented with calling it something else, like a maintenance visit or a clinical visit, and patients just got too confused. So we decided we needed to keep the cleaning in there. We just needed to add something a little bit different. So
Yeah.
When a patient's wrapping up their recare visit, something along the lines of, we saw some inflammation on the lower right for you today. I was able to go in and clean out all the bacteria for you today. But to keep that healthy, I would recommend that we see you again in 6 months so that doesn't turn into anything worse. That sounds so different than saying, do you want to schedule your next cleaning?
That really is such a huge improvement on the way you're communicating with the patient.
Yeah, and so it's a system, and that's the expectation of how my team is expected to talk. And so we have workshops, we have verbal skill role play little workshops, which everybody hates initially, but then after the fact, they're like, I actually do feel more comfortable saying it that way. And so it's not a one person thing. It's definitely a team effort. And I will say that dental intel has been really helpful in tracking amongst the hygienists in particular, the reappointment rate. And so of course, all of them, again, hygienists are just like dentists. They always want the A. They almost see it as a competition, like I'm going to get 80%. So it's kind of fun.
And then I'm actually interested to know who runs those little training meetings. Are you taking turns? Do you do that? Does your office manager do that? Who runs those?
Yeah, so I'm actually super proud of this. I used to exclusively run them, but I actually have now a hygienist that's been with the practice for 20 years. I have my now office manager who has been with me for almost 10 years. Previous to that, she was my chairside assistant. And so now I can kind of, because they are so highly trained from just being around me so much, and also my one hygienist, I've actually learned a lot from her. So I allow them to now teach the team too, because between being around me and my hygienist just being in the practice for so long, I've got built-in teachers. So if we need to break up in departments, and I work with the doctors, and my office manager works with the assistants, and the hygienist works with the hygienists, I have pros in my office now that are highly, highly skilled to be able to teach this.
Which that's great. Well, I'll just call this out. That is such a good skill and a necessary skill for a talented leader, is to take the areas where you have expertise and to pass that expertise on to that next group, so that you aren't totally reliant on being like the hero all of the time, right? Like, obviously it feels good to like be the person where like everyone has to rely on you, but yeah, that's why I was asking. I was pretty sure that you had passed a lot of that responsibility on and had trained people up. And maybe to your point, that's not something that necessarily happens overnight. Like, it's not like, hey, in 3 months, I can have an office manager ready to do everything that I want them to do. But over time, if you can have that kind of in the back of your mind, like, hey, I want to be a really good leader. I want to help my team level up and be able to do the things at least I'm exceptional at, and then I can learn from them as well.
Yeah, and I think that's a really good point because, back when I was initially the sole owner of my practice, I had 5 employees. I had 3 chairs, I had 5 employees, and I thought I had it down on how to manage a team. Well, it turns out, in 2020, I ended up building out a new space. We doubled, almost tripled our square footage. And with that, had a lot of explosive growth. And so as we grew quite quickly, I had to add a lot of team members. And I found out very quickly that managing 5 people is way different than managing 14 people. And so I had to kind of, we had some rough growth period of learning. But one of the things that I learned is that I needed to train up some of my veterans to be the leaders, because I couldn't be everywhere at once and I couldn't teach everybody everything. So absolutely, that was something that I learned the hard way. Probably lost some people along the way because of that. But that's part of owning a business.
Now, I want to shift for a minute. I for those that are listening, I became aware of Dr. Turnwald through the Speaking Consulting Network. So he's involved there, and I'm aware that he also, he's obviously very skilled from a business perspective and clinically, but also talks about some of the mental health things. So you kind of started to like go into this place where you are scaling your business, you got 14 team members, and all of a sudden things start to change. Like, I can imagine it starts to feel like, yeah, I think a lot of doctors do as they grow their business. Like, there was one here locally that his goal was to get to 1.2 million in production himself. And he got there and he just expressed like, I'm not like happy. Like, I thought I would be happy once I hit that goal. But I'm not, and we can go back into a business conversation, but I'm really interested to hear from you, Dr. Turnwald. Like, did you have some experiences where you're like, I don't know how I'm going to handle this? And then what advice would you give to doctors? Like, how do you work through that? Some of them, their path is going to be, hopefully not, but some of them, maybe their path's out of dentistry. They're like, I can't do this for my career. A lot of them will make a path like continued in dentistry. So how do you keep doing dentistry and find joy there? And then some of them, their path maybe is doing something similar to you, where you're not as like intense on the clinical days and get to be more of an executive in dentistry. So do you mind sharing a little bit about your path there?
No, I'm happy
I think people are always interested. Like, there's this ADA graph that I follow every month. And since 2021, doctors' confidence in both the US economy and their dental practice has been like coming down. Like, it started at like 85% confident, and now we're at like a 3-year low at like 60% confidence. So that confidence has been coming down in like, hey, are we going to be successful from a business perspective? So I imagine that any advice you could give there, I'm sure will be warmly welcomed by folks.
Yeah,
because you be in a good place. I assume so. You're
no, I know. I've had my times where things weren't so good, but this is something that I'm super passionate to talk about because I think it's coming out of the shadows a little bit, but I think it's under talked about in dentistry. And there really is a mental health crisis, in the industry. And, some of it's built in, like, my friend, Dr. Kyle Stanley, does a really great course for dentists and mental health. And, anyone that's struggling, I highly recommend Googling The Light Side with Dr. Kyle Stanley. But one of the topics that he teaches is that as dentists, we're constantly working in an environment of fear. So what that means is, we're seeing people who their first words out of their mouth when you walk in the room is, don't take this personally, but I hate the dentist. Or, I'm super scared to be here. Or are you going to have to give me a shot? Or is this going to hurt? All those types of things raise our blood pressure. And, as gentle and as kind as we want to be, we're still having to give injections. There still might be some procedures that aren't super, 100% comfortable. And I think that all takes a toll on us. day after day, procedure after procedure. And, that's just one of the aspects. We're not portrayed the best in the media or the movies, we're in a lot of horror movies and that type of thing. And so, I think just in general, it's a tough job to be in. Nobody ever walks up to a librarian and tells them, "Hey, no offense, but I hate librarians."
Yeah, no.
So,
like
so
that's
a
unique thing to dental.
It's totally unique to us, and I think we all carry that with us to some extent. And I also think that as far as like the business, to the business aspect of it, especially if you're a practice owner, I've been very, very fortunate to own a 100% fee for service practice since I started in the office. And it's definitely not a walk in the park. It has its own set of problems. But I really think that between the labor shortage and the insurance reimbursements, I can totally see how a lot of doctors out there are not feeling very confident. I mean, it's simple math. Expenses are going up and reimbursements going down. That means you have to work faster. That means you have to cut corners on things. And I'm not saying you're necessarily cutting them clinically, but you might be cutting them from a patient experience standpoint, faster prophy visits, faster composites. I remember I interviewed at a couple of offices when I first graduated. They're like, you have to be able to do a root canal in 45 minutes. Like, how can you predict that? So, and some people may be able to. I'm not a fast dentist, but my point is like I can totally see how that's leading to the issues that people are experiencing, and that's making the patients leave. That's making the patients unhappy. When the patients are unhappy, that ruins your day, that ruins your team's day, that leads to team turnover. So it's just like this vicious cycle that just kind of keeps going and going. And so I think it's one thing to make sure you're taking care of yourself. And that's one of the things that I'm super passionate about helping dentists do too, is to work less. Because believe it or not, you can actually work less and make more by, working smarter, not harder, and actually take care of your patients and take care of your team better by working less. So that's like a whole comprehensive discussion.
Yeah, I was gonna say, can we go there a little bit? Maybe like a couple of, you don't have to go like deep into that. A couple of like, hey, these are Dr. Turnwald's hacks. Like, if I could give you a couple pieces of advice, these are some things that are helpful.
Yeah, I would say, I mean, we talked about a little bit of it earlier. I mean, making sure patients are reappointing for not only their recare visits, but for prophies. Instead of having to see 100 patients in a month and having, I forgot what you told me the average was, acceptance rate, having an average of 20 or 30% acceptance. What about slowing down for 50 patients and getting your acceptance up to 50%? What about
why don't we go there? So treatment. So let me tell the audience a little bit of something about Dr. Turnwald's practice. So the average practice, I'm looking at treatment dollar acceptance percentage. So there's like a number of things that go into this, right? Like, on what percentage of patients are we diagnosing something? And then we look at, on average, how much dentistry are we diagnosing? And then we're looking at, are patients saying yes to something? Like, are they starting this clinical plan that we've created? Because sometimes it rolls out in phases. And then at the end of the day, like 12 months later, what percentage of the treatment that was originally presented is actually getting scheduled or completed? Okay, so that's the treatment dollar acceptance. And the average practice in the US, if you present $1 million, you're getting $390,000 scheduled or completed in those next 12 months, so 39%. And Dr. Turnwald's practice is at 46%, so 17% above the industry average. And it's not just with like small cases. Like, I'm seeing that. I went and looked at like, what if they present a $2,500 case? What if they present a $5,000 case? What if they present a $10,000 case? And clearly you guys have established a relationship with patients, and with like, even like what you said earlier with hygiene. I bet there's some like clever things you guys are saying, or the way you approach the conversation on treatment, that's probably really helpful. Like, the patients clearly understand, like, oh wow, these guys are clinical professionals and they're saying yes to much more than the average patient is. The other thing I'll call out is that they're also not just presenting, because some people could like game this, right? Like, you could really increase your case acceptance if you only present simple stuff. Like you're not getting into more advanced dentistry, but we're also presenting, $1,300 on average to patients when we're diagnosing, in comparison to the industry average of $830. So like there's clearly more advanced dentistry happening in your business. So I'm going to shut my mouth now and let you talk, keep going on that talk track. So like I asked, like, what are some of the hacks with the way you can work smarter and not harder? And this case acceptance workflow is definitely one of those places where you could slow down. You don't have to see as many patients and really make sure that the treatment that you're finding is getting completed. And I think you could make an argument that you're doing best by the patient and best by yourself in that situation, right? So go, I'll shut my mouth, let you talk.
No, it's all good. Absolutely. So I think the problem, or I shouldn't say the problem, but I think the difference between how we do it at my practice and just in general is that a lot of doctors follow the dental school model, which is I'm going to evaluate you, I'm going to look at all the problems, and then I'm going to decide what your treatment plan is. And then I'm going to tell you what you need. And so I have actually a really good example of this because I have a decent amount of patients that come to our practice looking for second opinions. And almost always the words that come out of their mouth is, they told me I needed this, but I don't think I need it. Or they told me I needed all this stuff and I don't think I need it. And it's interesting because a lot of times I can, just by slowing down and listening to the patient and unpacking emotionally what they want and taking them through a really positive new patient experience where you co-diagnose and you show them what you see instead of telling them what you see, I can get them to say yes to the exact, because often I do 100% agree with a lot of these treatment plans. It's not that they were over treatment plan, it's just that they were told they needed something and they don't understand why. I take them through my new patient experience, and at the end of that, they end up accepting the treatment plan, and usually at a higher fee because I'm 100% fee for service, and they schedule all of the treatment. And so I think it's just a matter of, instead of telling a patient what to do, it's telling them what you see and asking permission to be like, hey, is it okay if I find some things today that I tell you about it? Treating it like a physical, like an annual physical. I don't want to go to my doctor and have him decide like, I don't know if I'm going to tell Ben that he has diabetes today because I don't know if his insurance is going to cover it. Like, I want to know everything. So I explain it that way to my patients, and I tell them what I see, what problems I'm concerned about, and then I give them, I tell them what the possibilities are. I don't say you need this. I say, if we wanted to stop that permanent destruction in your jawbone, one of the ways that we could do that is with some gum therapy. That sounds so different than you have pockets and you need a deep cleaning. So I think that's where a lot of doctors get into trouble, is one, they're using hard words, and two, they're not really taking a patient. You really have to take the patients on a ride of showing them what you see and what the consequences are of not doing it before you just give them what the solution is. And I think that's where a lot of us get into trouble, because not everybody wants to do Invisalign. Not everybody wants to fix the brown tooth on number 9. And so it's saying, hey, that tooth in the front of your mouth that's brown, does that bother you at all? It doesn't? Okay, cool. Then we move on to the next thing. Instead of me diagnosing a crown, they get up front and they're like, the doctor just told me I needed this $1,000 or $2,000 crown. So that's probably the biggest difference, is not giving patients a treatment plan, giving them a problem list, and then asking them, ideally having them ask you like, well, how do I fix that? Because then you're never going to overdiagnose. And so that's why our numbers are so high, because I'm not treatment planning every little thing that I think they might want to do. It's totally patient-based. And you're going to have, some patients who want to do a full mouth reconstruction, and you have some patients that might just want to do some scaling and replaning and slap a couple of composites in there and maintain things, and they're okay, losing some teeth. So I think taking the monkey off of our back, not only from a mental health standpoint, takes the anxiety off of me, because I don't have to decide how much I'm going to present. They've already given me permission to tell them everything that I see, and it just makes it so much easier to do it that way than it does to tell somebody how many thousands of dollars of treatment that they need.
Yeah, I love what you said. I'm going to go down one more little rabbit hole with this, but I'll
Sure.
just call out for listeners a couple of things you mentioned, like that I thought were really clever. I think there are clearly some verbal cues that they can learn from you. Co-diagnosing, I thought was a great term. I loved you gave it, I call it like a permission play. It's just a communication way of whenever you're going to give someone a suggestion or you're going to go down a corrective path, it's always helpful, just in communication style, to do some type of permission play. You know, hey, would you be okay if I did this thing? I do it with my kids and it works like magic, right? Like, hey, would it be okay if I talk to you about your chores, you know? And they're like, yeah, like they almost can't say no. So I think that permission play, and then the way that you talked about like simplifying language, but also making sure that it still is clinical, you know, I think was really helpful. Where I hear a lot of people talking about dumbing it down, but also you can't like dumb it down too much. Now I want to add one more layer. So you clearly have thought through like verbally, how do you communicate? But I caught earlier that you're doing some visual things. You mentioned intraoral scanners. So as you're co-diagnosing with the patient, what types of visual tools are you using? And then what is the patient seeing as you're talking through treatment?
Yeah, so I think there's two parts to the co-diagnosis. I think the first is the verbal. So just as a quick example, when I'm doing my new patient exam, and I'm doing, you know, the perio probings, instead of just getting through that and rambling out all the numbers to my assistant, I tell the patient, the next thing we're going to do is look at the health of your gum tissue. I'm going to use this little instrument here that looks like a ruler. Some patients have never been probed, so I'm going to use this little instrument here. It looks like a ruler, and it's going to take some measurements. And what we're looking for is the happy, healthy numbers that are 1s, 2s, and 3s. So if you hear me say anything higher than that, that means there's some infection around the gum tissue. I also, this does not need to be uncomfortable. So if you feel anything more than a tickle around your gum tissue, just let me know and I'll lighten up my touch. So letting them know that, you know, it's going to be comfortable, but also you see them tense up when you say a 4 or a 5. And so they already know now, and they're kind of like along for the ride, that like you're going to be telling them something not so good, as opposed to them zoning out or being on their phone while you're reading off a bunch of numbers. So I think the co-diagnosis is part of it. You know, coming up to a tooth that might be cracked or broken and be like, you know, I'm seeing a cracked tooth here. I'm going to show it to you in a minute, but has that started to hurt yet? Kind of like seeding, like this is going to be a problem at some point. And then I think after you get through your exam and you kind of brought them along for the ride, using what's called transparent dentistry. And, you know, I think the days are over. So I think the days are over when the doctor knows best. And, you know, I think a lot of our elderly patients are kind of still in that mindset of like, I'm going to go to the doctor's going to tell me what to do, and I'm going to listen to the doctor. But I think everyone from the baby boomers forward are like doctor Googling like a ton. And so they need a little bit more than that, I think, for you to gain their trust. And so I take a full series of pictures, and I, you know, when I'm teaching this, I tell people you can use your smartphone, you can use a fancy DSLR camera like I use, you can use a digital scan, you can get $200 little pen cameras, something to show the person like, don't take my word for it that it's cracked. I'm going to put it up on the big screen and we can look at that together. So that's transparent dentistry, because you want the patient, I mean, you're never going to get them to say yes to doing the treatment unless they own that they have a problem. And so if they don't believe you that they have a problem, then, I mean, you might as well not even talk about treatment, and you definitely better not send them up to the front desk to get a fee. So so that's what transparent dentistry is I'm going to show you what I see. And I'm not a fan, I'll go off on a little tangent here. I'm not a fan of using x-rays a ton. I will use them to show bone loss and maybe infections and stuff like that. But I think that we over rely on those as our visual aids in dentistry. And honestly, I'm sure we've all heard patients say this. They honestly just think it looks like a bunch of fingers and toes.
It does. It is
black and white blobs. So if you're trying to use that for patient education, that's gonna be very difficult. Where an actual color photograph or a colored scan of their actual tooth is gonna be so much more powerful.
Man, I love that. Now time flies. We're already like coming up on there. This is one I think we could probably do a part 2. Well, Dr. Turnwald, we always ask the question to every one of our guests, what does growth in dentistry mean to you? We hit some awesome stuff today. Thank you for joining. But I'd love for you to spend a few minutes in answering that question. What does growth in dentistry mean to you?
I would say my focus, my hope that I would have for our industry in general is to focus more on mental health. And I think that it can be described in three different ways. The mental health of our patients, and the way that I would describe that is I think there's really a lot of opportunity to turn patients' perceptions of the dentist around. This is one of my favorite things about being a dentist is when patients tell me, they come in all scared and nervous, and after 6 months, a year, 2 years, 5 years in your practice, they pull you aside and they're like, you know what? Today was the first time that I came to the dentist and I wasn't nervous, or I'm not scared anymore. That's huge. I mean, there are just so many people out there that are petrified. They don't sleep the night before. They're not able to focus on things. They're not being present with their family because of an upcoming dental appointment. So I think the mental health of our patients, I think the mental health of our teams, and I think that leads to a lot of the turnover and the retention of our employees. So making sure your employees feel supported, making sure that they work in a fun office and that they, feel respected. And then finally, us as clinicians or as dentists, I think just really making sure that we're carving out enough time for self-care and, getting ourselves, if you feel like you're on a hamster wheel, putting some steps in place to get off the hamster wheel.
Well, if the listeners want to reach out to you, what's the best way to contact? Are you okay if we give like an email or
Yeah, for sure.
phone number, show notes?
Yeah, I'd invite people. You can either find me on LinkedIn, you can go to my website at lifegoalsdds.com, or you can shoot me an email at ben@lifegoalsdds.com. And I'd love to, even if it's just maybe I'm not the one to help you, but I can put you in contact with someone who can. I'm always happy to chat with anyone and everybody to help you do better and improve yourself and improve your business.
Well, and I'll just give my own little plug. If I'm ever looking for someone to help me, if there's like data that shows that they know what they're talking about, then I'm way more likely to engage. So, man, if you're looking for someone, for sure, hit up Ben before he gets too busy, in my personal opinion. So, Ben, thanks for coming again today. For all the listeners, thank you as always for listening and tuning in. This has been a Growth in Dentistry podcast. Keep growing. We'll see you guys soon.